Brought to you by Skinsational, Dr. Luciano.
Welcome back. We all want to look and feel our best. That's a given. But sometimes it's really hard to get rid of that unresponsive body fat, that fat that you just can't get rid of through diet and exercise. So today we have our resident cosmetic surgeon, Dr. Luciano, who is here to talk about liposuction. Good morning, and thank you so much for coming in, Doctor.
Thank you. Good morning, Megan, and good morning, Studio 10.
Tell me a little bit more about liposuction. It's definitely something that has gained popularity. You've been doing it since 1986. What is it?
Liposuction is the #1 surgical cosmetic procedure in the world. Very popular nationwide, worldwide. And you can remove localized pockets of fat in certain areas. Those areas are body areas. Could be on your areas under the neck, around your breasts, in the abdomen, and the brow rolls, and the back, and the thighs, inner knees, hips, saddlebags.
Our bodies have a lot of fat in it, clearly, as we're seeing.
It may.
I mean, a candidate that would be able to come through your door, there's specifics that you need to follow, correct?
The ideal candidate for cosmetic surgery should have realistic expectations. That's #1. #2, they need to be in good health.
Okay.
And be within certain adequate body weight.
Okay.
The people have to know that liposuction is not weight loss surgery. You're not going to look like Miss America or Mr. America after surgery. You're going to have an improvement. Here we have some before and afters that you're showing here. There's a typical under the chin area with extension to the jowls a little bit. Sometimes people recommend a facelift for that, but lipo is a very good alternative, and it's done with small 4mm incisions that come from behind the ear and go into this area here, and you have the after results that are very pleasing.
And you don't see any type of scarring also in that after picture. It's not very invasive. We have a lot of other before and after pictures because there's so many places on our bodies. Let's show another.
This is typical arms. When a young woman has good elasticity, good retraction, and this is the outcome that you get. Here we have man boobs, aka gynecomastia. 1 in 6 to 8 men have it, very common, and we do it under local anesthesia, and it's a very good procedure. Here's to show that you can have high definition in the abdomen. If you look at the tummy, he's not bad, but he wants to improve that and show a six-pack. Women, over time, they may gain and lose weight, and you have the rolls in the back of the skin that lost elasticity. So liposuction is an excellent option because you can increase the tone and the elasticity with high definition lipo. Also, if you lose weight, you enhance your results. Here's a young woman, 25, lost a lot of weight, so you have a more snatched waist even. This to show immediately after. You show that the abdomen is flat as opposed to bulky, and better contour and better shape.
Flatter, but again, I know you said that was the immediate result, but that was bruising. It goes away?
It all goes away. Bruising goes away anywhere between 2 weeks or 1 week, depends on the area. And the most common complications of liposuction include bruising, seroma, hematoma. You have to drain those areas. However, every surgery has minor to major complications, and when you have a consultation about lipo, you have to go and ask a lot of questions and ask for transparency.
And then afterwards, it kind of leads into that. What's the recovery time for something like that?
It depends on how many areas you do. If you do one small area, maybe 1 day, or at the most, you're going to have maybe 2 to 7 days, and you can go back to work perhaps in 1 or 2 days.
Well, that was super informative. Dr. Luciano, thank you for coming in. If you want more information, you can head to his website, skinsationalri.com. And we know you have questions really about any type of procedure, and you can email us at studio10@WJAR. We want to answer them on one of our shows on a Wednesday. Next Wednesday, though, we'll be talking about tummy tucks, and that's a procedure I'm sure you're all curious about.